New Brunswick has declared a province-wide outbreak of whooping cough. The disease is highly contagious and can be very serious for babies and young children. More than 140 cases have now been confirmed. Dr. Christopher Labos is an epidemiologist and cardiologist, and he's also the author of Does Coffee Cause Cancer? And he joins us this Saturday morning. So nice to see you, Dr. Labos. Let's get right into it because we know there is a vaccine for whooping cough. So how unusual is it to see such a high number of cases in the province?
It is a little bit unusual. Now, that's not to say that there haven't been outbreaks of whooping cough before. It has happened before. It likely will happen again. When it does happen, it's usually a combination of waning immunity and also a lack of vaccine coverage. I mean, you have a vaccine, but vaccines only work if people get the vaccine. And while our vaccine coverage in Canada is overall pretty good, I think at the last estimate in the 2019 data, it was in the high 70%, 75 or 76, something in that range. You know, it's not as high as it could be. So if we did a little bit better with vaccination, especially if we could get pregnant women vaccinated, that would go a long way to driving these numbers down. The vaccine is not 100% effective. That's true. It's somewhere around 85 to 90% effective in terms of preventing severe illness from whooping cough and landing small babies in hospital. But, you know, if we can do a little bit better with vaccination, we keep the numbers low. And it's worth pointing out that we are much better now than we were in the first half of the 20th century when whooping cough cases were orders of magnitude higher than they are right now.
And we were talking about the fact that this is serious for babies and young children. We were looking at images of babies and young children as you were speaking. So how is this transmitted?
It really is a person-to-person infection. So you get sick, you cough, sneeze, breathe on somebody else, and you transmit the bacterial particles to them. And so it is spread person-to-person. You often see it spread amongst households. And, you know, when babies and young children get sick, it's usually their siblings or their parents who caught it from somebody, brought it back home, and then it spreads within households. You see, you know, spread within schools as well. But like most infectious diseases, it's a person-to-person thing. And so one of the important metrics or one of the important things that we need to do to limit the spread is if you are sick, stay home. And most importantly, if you are sick, get treated. Because the good thing about a bacterial infection is that you can treat it with antibiotics.
If someone has the whooping cough, those symptoms may sound like they just have a common cold. So how do we differentiate with those symptoms?
It can be tough, and a lot of cases of whooping cough, especially milder cases, probably do get not diagnosed, and that's how it's able to spread. I mean, honestly, the only real way to know is to get tested. You know, to go to a hospital and get tested for it. And I think that's the important point. A cold is going to get better on its own, right? Viral illnesses like the cold, children get them, you know, all the time. They do start to get better very, very quickly. So if your child is not getting better, is getting worse, is struggling to breathe, and is clearly suffering, then that's an indication that you need to go to the hospital because you probably do need antibiotics at that point.
So what do people do if they're living in close contact with family members or are concerned about this potentially spreading?
Yeah, that's a tricky situation. In that context, I mean, you try to isolate people as best as you can. You try to prevent having these contacts spread as much as possible. Sometimes you do need to treat people presumptively, especially if they're high-risk cases. That becomes very much a case-by-case thing. But the most important thing is first to identify the cases. And unfortunately, the only way to get tested is to go to a hospital. You could get tested, and then you can start doing contact tracing within the family if it's appropriate to do so.
Okay, it's almost September. For some children, they are already either back in school or will be soon. COVID-19 is still out there. So with kids heading back to the schools, universities, those classrooms, what can we do to protect the kids, especially with the spread of a new variant?
Well, the most important thing that you could do, especially with regard to school, and of course that extends to work as well, is really push for an improvement of indoor air quality in your school or place of business. And while long term, it's going to be much better if we can upgrade our ventilation systems and deal with some of our older infrastructure that doesn't have central air. In the short term, a very, very simple thing you can do is get air filters for your classrooms. That's going to make a big difference in preventing the spread of all kinds of diseases, not just COVID, but also influenza, the common cold, whooping cough, a lot of diseases that are spread person to person. If you can clean the air, that's going to make a big difference. That is the one thing that you have at your disposal. And of course, long term, or in the medium term, the issue is going to be vaccination against COVID once the new boosters are out.
Speaking of vaccination, should people get the boosters sooner, or should they wait for the fall-winter wave? Is there a difference with the protection?
Yeah, I get asked some variant of that question almost daily, or perhaps not daily, but at least weekly for the past few months. I think on average, unless you are a particularly high-risk individual or doing something that's going to be particularly high risk in terms of travel, you're probably better off waiting for the updated booster that's going to come in the fall, because the updated booster, we presume, we're still waiting for the final confirmation in Canada. We just heard from the US that they're going to be updating the vaccine to reflect the new flirt variants. The point is that there is going to be an attempt to try to match the new booster to the circulating variants to get you better protection. And so while we are experiencing a summer boost now, a summer bump now, we are expecting that the winter bump is going to be much larger. And so if you can hold off for the better matched updated booster in the fall, that's probably your better bet.
All right, Dr. Christopher Labos, so nice to see you. Thanks so much.
My pleasure. You take care.